Hi everyone, welcome back to my YouTube channel. Today we are going to talk about sphenoid bone, and here at the side you can see the superior view and posterior view of sphenoid bone for the reference. So let's start our topic with introduction. Sphenoid bone is a butterfly shaped bone located at the base of skull, centrally positioned between the frontal bone, temporal bone and occipital bone. It plays a critical role in connecting and stabilizing multiple cranial bones and also houses key anatomical structures involved in vision and neural function. First, we will talk about location and articulation. Sphenoid bones form part of middle cranial fossa and contributes to the orbits and nasal cavity. It articulates with the several bones, like it articulates with the frontal bone anteriorly, it articulates with the temporal bone laterally, it articulates with the occipital bone posteriorly, it articulates with the parietal bone superiorly, and also articulates with the zygomatic bone, ethmoid bone, and palatine bone and vomer in various positions around the skull base. Its central location gives it a structural keystone role in the cranial skeleton. Anatomical features. It has body of sphenoid, greater wing, lesser wing, and pterygoid processes. Now let's talk about these one by one. First we have is body of sphenoid that contains sphenoidal air cells. As you can see here in diagram, the body of sphenoid is visible. It drains into the nasal cavity. It houses the sella turcica, that is the depressions that accommodate the pituitary gland. It includes the dorsum celli, that is the posterior boundary of sella turcica. Second, it has greater wings that extend laterally and contribute to the walls of orbit and cranial cavity. It contains several foramina like foramen rotundum, foramen ovale, foramen spinosum, through which original nerves and vessels pass through. Third part is laser wing of the sphenoid bone. It projects from the upper portion of the body. It forms part of the roof of the orbit. It marks the boundary between the anterior and middle cranial fossa. Fourth is pterygoid processes. They extend downward from the junction of the body and greater wings. They serve as a site of muscle attachment. They include the medial and lateral plates which form part of pterygoid fossa. Development and ossification of sphenoid bone. Sphenoid bone develops from multiple ossification centers including both cartilaginous and membranous origins. Due to its complex morphology, it is one of the most intricate bones in terms of developmental anatomy. The fusion of its various parts is not fully complete until after birth in and into early childhood. Functions of sphenoid bone. Sphenoid bone performs several essential roles. First, it anchors the cranial skeleton. Second, it protects vital neural structures such as the optic nerve and pituitary gland. Third, it forms part of the orbit, cranial base and nasal cavity. Fourth, it is the passage for the cranial nerves and vessels through the foramina. Fifth, it provides muscle attachment site for muscle mastication. Clinical significance. First is pituitary tumor. They may press into the sella turcica affecting hormonal regulation. Second, fracture involving sphenoid foramina may impair cranial nerves. Third, sphenoid sinusitis that can present deep-seated headaches and may threaten adjacent neurovascular structures. Fourth is surgical access to pituitary gland that often involves transsphenoidal approaches through the sphenoid bone. And this was all about sphenoid bone. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.